We'd like to tell you about digital remote monitoring in Kent and Medway. I'm Mark Needham from Health.
And I'm Georgina Walton from Social Care.
Our aims. In March 2020, we recognised there was an immediate need to move to digital pathways in primary care due to the pandemic. After the impact of Wave 1, we decided to build a digital bridge to care homes because the homes were cut off. And also during the winter, we used digital remote monitoring to support COVID patients and monitor their oxygen levels.
So what were the key elements of this project? Getting the foundations right was essential, and we had to ensure that we had a confident and competent digital literate workforce, care sector workforce, that could embrace a range of technologies, including digital remote monitoring. We approached this through a range of activities, which included training on Microsoft Teams to enable video consultations, NHS mail training to ensure the secure exchange of information, and introduced video care phones from Social Care, which was introduced during the pandemic to reduce social isolation and connect family with people with family and friends. We also distributed 550 iPads and delivered training on how to use these devices effectively, including a range of apps so that care workers could utilise the apps such as Help to Care, which was introduced in Kent and Medway for people that provided care and contains fundamental care elements to keep people well and out of hospital. We also connected 205 GP practices with 400 care homes.
Thank you, Gina. What was our approach to digital remote monitoring and technology? In December, we procured a digital communication system with 5,000 oximeters and 5,000 digital licenses. By providing apps for patients at home and care home staff, they could send their oxygen saturation levels, which could be monitored remotely by our clinical teams. Since then, we are now putting in place monitoring for 5,000 care home beds. We're extending the digital monitoring of a range of vital signs, including blood pressure, temperature, weight, and pulse. Digital remote monitoring has allowed us to be preventative and also to start doing monthly health checks. Digital remote monitoring also allows us to prevent deterioration and monitor more intensively patients outside of hospital. We would now like to talk to you a little bit about the outcomes and impacts of our work.
So what has been our key learning? It's really important for the health and social care partnership to work collaboratively and gain the trust with the care sector and engage and work closely with the care sector to understand the challenges that the care sector is experiencing. When we started our project, we understood that there was wide variation in digital literacy and infrastructure within care homes. We spent time understanding this situation to understand what support the care sector needed and to inform our project plan. This enabled us to build the foundations to embrace digital remote monitoring and other technologies. Once we built the confidence with the care sector workforce and built the relationships, we started to win the clinical hearts and minds to embrace new technologies such as digital remote monitoring. This was supported through sharing case studies and insights from the people involved and demonstrated the impact of this work. This work has now informed our future digital roadmap and has informed the development of digital leadership roles such as clinical safety officer, digital nurses, and care home facilitators.
Thank you, Gina. And we'd also like to share a little bit about the impact that this has had for our patients and our system. Building on the confidence of staff, we've managed to monitor 6,000 patients remotely. Of these, 1,000 patients have received digital remote monitoring. A very small proportion have been escalated to A&E or the emergency department, which suggests that we've prevented the deterioration of patients, but also helped them get support from hospital when needed. We're really only beginning to understand the use case of digital remote monitoring, the benefits of clinical decision making, and the opportunities for providing more proactive care for patients. The national team believe, as do we, from the evidence we've seen so far, that this has saved lives.